Okay, my name is Eric Madison. I'm a rheumatologist at the Mayo Clinic in Rochester, Minnesota, and I'm going to just briefly discuss the results of a study that we did titled Hospitalization Rates and Utilization Among Patients with Rheumatoid Arthritis, a population-based study from 1987 until 2012 in Olmsted County, Minnesota. Briefly, what we did in this study was to examine hospitalizations for patients with rheumatoid arthritis. We know that in America, about 1.5 million people have rheumatoid arthritis, so there's an enormous health burden of this disease. We also know that patients with rheumatoid arthritis tend to be sicker than patients who don't have rheumatoid arthritis, but we have no idea about whether patients with rheumatoid arthritis actually require more hospital services than patients who don't have rheumatoid arthritis. What we learned in this study is that if you have rheumatoid arthritis, you are 50% more likely to be hospitalized than a person who doesn't have rheumatoid arthritis. That's a very significant increase in the amount of hospitalizations that people with rheumatoid arthritis need. Why are they hospitalized? What we found out in this study is they're hospitalized more frequently for infections, which they're susceptible to, for cardiovascular disease, which they're susceptible to, for lung disease, which is a complication of rheumatoid arthritis, and then also hospitalizations for musculoskeletal purposes, including joint surgeries, are more common in patients with rheumatoid arthritis as well. Who are the patients with rheumatoid arthritis that are more likely to get hospitalized? Patients with bad disease. Disease severity markers such as high inflammatory markers like the sedimentation rate, patients who are rheumatoid factor or CCP antibody positive are more likely to be hospitalized, and patients who have advanced or erosive disease are more likely to be hospitalized. So this is the very first time that anyone has tried to look at hospitalizations for rheumatoid arthritis. Since we know now that patients with rheumatoid arthritis have a lot more hospitalizations than age and sex matched people who don't have rheumatoid arthritis, and we know that patients with rheumatoid arthritis have a lot of comorbidities, a lot of diseases that are associated with rheumatoid arthritis, what we better understand now is the importance of adequate treatment of rheumatoid arthritis to reduce the overall disease burden and hopefully also reduce the hospitalization rates for patients with rheumatoid arthritis.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.